Welcome to Concussion Talk Podcast. I'm Nick Mercer. This is episode 62. I'll be talking to Kim Furlong. Kim is a physiotherapist and the owner of her own physiotherapy clinic here in St. John's, Newfoundland and Labrador. It's called NL Balance and Dizziness. Kim gives excellent descriptions and definitions of balance and dizziness for both the general population and people with brain injury, concussions, or other neurological conditions. Concussion Talk Podcast is presented by HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more. Okay, Kim Furlong now with NL Balance and Dizziness. And good Kim, could you please introduce yourself and also just hide for the name Kim, which I've just said. But your client at your clinic, NL Balance and Dizziness. So describe what that is and where you are and what you guys do there. It's a long thing, but yeah.
Great. Thanks, Nick, for inviting me to speak to you on Concussion Talk. It's a real privilege to talk to you.
You've been trying to get this for a while.
I'm like number 65 or something.
62, but we've been trying for a while, though.
Yeah, so congratulations on that. So I'm Kim Furlong. I am a registered physiotherapist in the province of Newfoundland and Labrador. I consider myself an old fogey. I've been around practicing now for over 30 years. So when you're at something this long, you got to know how to do something right.
But you do have experience, though.
Yeah. I was lucky when I graduated. The Newfoundland government was offering bursaries. So I was really fortunate to be one of the recipients for a Newfoundland bursary. And at that time, back in 1984, when I got accepted to Dalhousie University, the Newfoundland government paid for myself. There were 6 Newfoundlanders.
Wow. And
we were fortunate. We got our tuition, our room and board, and our flights up and back paid for our program. So we were really fortunate.
That's good.
And after that 3 years there, came back and I had a fabulous job waiting for me at St. Clair's.
Wow.
So, I was
What kind of physio did you do there?
Well, it's funny, when you're in school, you kind of figure out what area of practice you like. And like medicine, you can specialize.
Yeah.
And our neurology professor had a professor come from the UK, and she taught us our neuro course.
Okay.
And when I graduated, there's one thing I felt I knew how to do, and that was a stroke patient.
Oh,
so my first 3 years at St. Clair's, I treated stroke patients, and I also was lucky to work with the rheumatologist there, Dr. Hamilton, Dr. Miskey, and I learned how to treat a patient with arthritis. Yeah. So that was my first 3 years, and then from there, my boss was Judy Bennett, and I went over to the health sciences, and I spent almost 10 years there on the neurology and neurosurgery floor.
Okay, nice. I know that floor well. Well, I don't know it well, but I spent a lot of time there.
Yeah. And, of course, there was a lot of fabulous neurologists and neurosurgeons there who I got to work with, Dr. Maroon, Dr. Goodrich, Dr. Phillips, Dr. Jacobs, Dr. Oganyemi. Almost all of them are retired now, but I had 10 fabulous years there with those physicians. And nurses like Judy White and Viola and Janet Brown. We had great experiences there. And being in Newfoundland, where that was the primary neurology and neurosurgery unit, we got to see everything.
Yeah.
So, back then too, Nick, there was a budget for education. So our director sent us on every course. So I got to go to the Rehab Institute of Chicago and learn how to treat a spinal cord injury patient. We got stroke certified. You name it, we got those skills. So I was very lucky. Yeah, and then after 10 years there, I left and went to the States. And for 10 years down there, I learned all about vertigo.
And that's where your dizziness dizziness part of their balance business comes from, I guess, is it?
Yeah. In the States, they market you, so they asked me to set up a balance program. And when I did, we had a client come in who was dizzy. And I'd never treated anybody with dizziness other than a low blood pressure problem.
Yeah.
That was the start of it for me. And then I spent the next 10 years learning all about vertigo and vertigo rehab. And then I moved back here in 2007, and I couldn't get a job at the hospital at the time, so I went over and asked the ear, nose, and throat doctors if I could help them treat their dizzy patients. And at that time, there wasn't very many physiotherapists around with that expertise.
No.
And basically what I've done for the last 10 years is, since I've been back home, is vestibular rehab and, of course, still some neurology rehab.
Yeah. Yeah, and I met you. I actually met you at Health Sciences. Was your colleague and both our good friend and my, like, I don't know what to say, hero, because she gets all embarrassed when I say that. But Jen Shears introduced us, and now she's working at Balance and Business. We're just until September, but who knows with all this what that's going to do. So you could please just talk about she's working there till September. So what is that place? What is NL Balance Business? Why did you set it up?
Great question. So when I worked in the States, I was in Maine, and there were balance and dizziness centers in almost every state in the United States. One most popular one being in Florida, the Florida Balance and Dizziness Center. So while I was there, I got to visit some of these balance and dizziness centers, and because I was in a smaller place in Maine, in Waterville, Maine, the therapists from Portland and Bangor, Maine, would send me patients. So I realized that there is a specialty type of care around rehabbing somebody with dizziness. And it's a multidisciplinary approach, because sometimes you need physio, OT, optometry, psychology, depending on what the dizziness problem is. So when I moved back to Newfoundland, I was working at a private clinic. I didn't have access to the other professionals, and I was in busy kind of a sports kind of back neck type physio clinic, which are kind of busier, louder, noisy, don't have a lot of private rooms. So when I came back here and started the vestibular rehab, I realized I probably needed to have my own place, because I wanted to have the proper environment, the proper equipment, and the multidisciplinary team. So I knew I wanted to work for another 10 or 20 years, so I said, okay, I might as well jump in. And to tell you the truth, Nick, when you're dizzy, it's not fun.
No.
And Newfoundland and Labrador certainly had access to ear, nose, and throat doctors, but they did not have access to vestibular physiotherapy.
Right.
And I wanted to improve dizziness and balance for people in Newfoundland and Labrador, and I wanted to do it right. So I decided to jump in, and I, with help from Paul Chafe, an architect, renovated the old garden center in Canadian Tire on Elizabeth Avenue. And that's where we are. So we turned it into a state-of-the-art balance.
It is. It's a great spot. I've been there a bunch of times, and I'm looking forward to going there again and getting on that recumbent bike this summer. Hopefully, this summer, if we're allowed out.
Thanks for that, Nick. I put a lot of thought into what a dizzy patient needs, and I feel we've achieved that here.
Yes.
There's still some equipment that I'm looking at buying, which I was going to buy before March 31st, and then the COVID-19 hit us, and we kind of put that on delay. But we have some real nice technology here. We have infrared goggles, which is a vestibular diagnostic tool, which helps us diagnose different inner ear problems. Yep. And we also have a solo step harness, which you've had.
Yes, I've used a few times.
Which ensures, So that's a fall protection harness.
Yeah.
And when I worked in the States, I had a lot of amputee clients. And when you're learning to walk on an artificial leg, there's not a lot of room for error. And if your knee buckles, you're down on the floor.
Yeah.
And in the States, with litigation the way it is, my boss let me buy a harness. So I bought a 15-foot solo step harness. And it was actually created by an engineer whose son lost his leg, and he was trying to learn how to walk, and his dad made this harness system with a track.
There you go. And you had so you had that in your place in Maine?
Yes, I had it for 15 years, 10 years, and I realized how much easier it is to help people retrain their balance. And in particular, you can't have someone practice falling. But
no.
If you have a harness system, you can practice falling. You can practice walking stairs, rocker boards, pretending you're on uneven surfaces, and mimic the outdoor environment with unpredictability and loss of balance. So that solo step harness is kind of a key piece of equipment that we have here, and we're pretty proud of that. And
it's great.
It's a 74-foot circular track.
Yeah.
So the one I had in Maine was a 10-foot straight track, so we're pretty excited about that.
Yeah, no, it's great, and so I was speaking of the balance, and you say you had a lot of stroke patients, and brain injury and stroke is one and the same, and concussion is similarly. So, what if someone comes in with a brain injury, concussion, or stroke for that matter? What types of balance challenges would they have, and can you just explain what the balance system looks like in a normal person's body, like vestibular, ocular, proprioceptive, all that stuff?
Sure. Well, you've done your research.
I know. Well, it's 17 years of living with this brain injuries.
Yeah. So you can answer the question probably just like I can. So there's a lot of info in that question. So maybe what if I just start with what balance is?
Go for it. That's better. More sense,
you bring me back if I forget the end. So your balance system basically is it's a fabulous function. It's a combination of work from what we call our sensory system, which is like a peripheral vestibular system. And that means information that comes from your vision, your eyes, information that comes from your inner ear or your vestibular labyrinth, to be technical, or your ear balance sensors, and information that comes from your body, like your joints, stretch receptors, your muscles, and your skin. So those are three kind of sensors that our body has to detect what's going on in our environment and our body. So those three sensors send that information to the brainstem and then the brain. And the brain is like the motherboard. The brain then processes what the eyes are telling it, what the ears are telling you with regards to your position of your head, your movement of your head, and then what the bones, joints, and skin tell it with regards to what positions our body is in space. So those are three sensors that send the information to the brain. Then the brain executes an action. It'll tell the brain how to position the eyes, where to move the head, and where to move the body. So the brain sends that information then out to the nerves, out to the brainstem, and the eyes, the neck, the head, and the body reacts. So that you can basically keep your center of gravity over your base of support. And when you fall, your center of gravity gets outside your base of support, either accelerated or unpredicted, and you end up falling because your normal balance strategies can't correct that fall.
Right.
So if we just talk about a concussion or a brain injury,
it all depends, I guess, on where their trauma is in the brain. Is that the busted point? Yeah.
People, and here's the thing about concussion. Sometimes the symptoms are subtle. You haven't damaged your eyes.
No.
Hopefully, you haven't damaged your ear, although you can with a concussion.
Yeah.
And you may not have a scrape on your body if you just got a bang or a fall without injury.
Yeah.
But the brain can get injured. It's a shearing force, an accelerated shearing force that can happen to the brain because they're nerves, right? It's like a jelly. It's very sensitive to shearing, accelerated movements, like in a whiplash. And you don't necessarily have to hit your head either. It could be that accelerated. So those axons or nerves get sheared and stretched. So therefore, the motherboard doesn't always process the information that the sensors are sending it.
Right.
And you can have problems with dizziness, problems with balance, problems with nausea, headache, and your ability to perceive your environment through your vision. A lot of people will think, oh, my eyes are blurry or I can't see. And a lot of concussion people or dizzy people will go to the optometrist to get their eyes checked, not realizing that it's not an eye problem. It's
a brain problem.
Brain problem, or a problem with the way the inner ear and the eyes are sharing information.
Right.
So, for example, if you have an inner ear infection that affects your balance sensor in your ear, you can have what we call oscillopsia, or blurry vision, meaning that the ears and the eyes aren't working together. And if I give you a simple example of that, sometimes if you're driving and you stop at a traffic light, you know you're stopped, your eyes can see nothing's moving, and your inner ear knows there's no head acceleration, and your body knows you're not moving. And if a car pulls up beside you,
you think you're moving.
You jam on your brakes.
Yeah.
You're moving.
You're going back.
So that's a bit of what we call a sensory mismatch between the eyes and the ears. The eyes have this strong assessment that there's a movement going forward in their peripheral vision.
Right.
And that our eyes are very strong, sending feedback to our brain. So it overrides what our body and what our ear is telling us, and it tells our brain, oh my gosh, I'm moving backwards, jam on the brakes. Yeah. So we call that a sensory mismatch. So if you have an inner ear problem, you can have what we call oscillopsia, where if you try to move your head as quickly and keep your eyes on a target, you can't do that. It's called a vestibular ocular reflex. But getting back to balance and dizziness, that's how we balance. So a head injury or an inner ear problem, the information from the sensor or the information from the motherboard's ability to process is off. So therefore your balance can be off.
See, that makes a lot of sense, yeah.
And then what happens, say you go into Walmart or Costco, or you go on an escalator at the village.
Yeah.
All of a sudden now, your vision can't stabilize because there's so much moving in your visual field.
Right.
So that's why people with a concussion, people with dizziness, feel a bit nauseous, a bit dizzy, and a bit unsteady when they go to a busy environment like Walmart.
Right.
And then,
sorry.
So then if your sleep is off because of your concussion, or if you're fatigued, if you're stressed, then your brain has a really hard time processing balance.
So I guess does dizziness work in the same systems, I assume, and so what does it? I have no idea about dizziness. What does that entail? What is that? I don't know. This can be a long. It's too complicated a subject, but dizziness is very similar to balance, but it just must be a vestibular. Obviously, I'm trying to think now. It's not an injury. It's dizziness would be not a mismatch, vestibular mismatch thing, but I guess vestibular mismatch, or what is it? I'm not sure what it is.
I'll help you with that.
Yes, please do.
So, dizziness, to finish your sentence, is a symptom. Dizziness is a symptom, just like pain is a symptom.
Yes.
The word dizziness is a symptom. And dizziness, Nick, it is good to talk about because 1 in 3 people over the age of 40 will have experienced some form of dizziness for some reason.
I'll be over the age of 40 in 2 weeks.
Well, happy birthday.
Well, not yet.
You're only a baby. You don't look a day over 19.
Thank you.
So it is important to talk about dizziness, Nick, and I'm really glad you brought it up. because it's a very common symptom. And dizziness is, because it's a symptom, it can be caused by many things. So the people I see, 70% of our caseload at Newfoundland Balance and Dizziness Center are people with dizziness. And here's the reasons why some of them can get it. Your inner ear has a balance sensor in there, which looks like a snail. There's a snail-like structure. The front is for hearing, and the back has 3 pipes and 2 sacs, 5 little sensors. And those have fluid and crystals in it. So when you move your head, accelerate your head, that helps you balance. If there's a problem with that, if you bang your head and have a fall, for example, you can get vertigo. And vertigo is a sense of room spinning that can make you feel like you're dizzy. And that can be the crystals in your inner ear got knocked out. And 6 to 20% of people with a concussion can cause trauma to their ear and get positional vertigo.
Yeah.
Or they have a stretching injury to the nerve. They can damage the labyrinth and have dizziness symptoms post-concussion or post-fall. But dizziness can be caused by inner ear other issues such as Meniere's. You can get a tumor called an acoustic neuroma, a number of different pathologies. Even shingles virus can attack the nerve in the inner ear and cause what we call a neuritis, where you have acute onset of dizziness, nausea, and imbalance.
So what about when you're sick or have the flu and you get people feel like not balanced or whatever? That's just general superficial ear like wax or whatever. Like what is that?
So that's a really good question because people don't understand dizziness. Dizziness can be caused by a number of things. So, for example, if you're sick and there's nothing wrong with your ear, if you're lightheaded, if you're dehydrated because you're sick, your fluid intake is down, if you've been in bed lying down for a long period of time and you get up, people feel lightheaded, right?
Yeah.
That's not an inner ear problem.
No.
That's more probably related to your cold. If you have an inner ear infection and it's inner ear, because the balance sensor is in the inner ear. The ear has 3 chambers. Outer, where the wax sits. Middle, the hearing bones are. And inner ear, where the balance sensors are. And it's hard to get at the inner ear because it's the 3rd chamber in. It's inside the temporal bone.
Yeah.
So wax can't cause dizziness. You stick your finger in or a Q-tip in or something too hard and puncture your eardrum, that's tell you not to do that. You can have some issues with your ear. So dizziness is really important to get diagnosed, Nick.
Yeah.
It can be just as simple as a blood pressure problem. People who are on blood pressure pills, sometimes they get dizzy, lightheaded if their blood drops, if they get up too quickly. That's a conversation with your doctor. Check your blood pressure. Make sure your pills are proper. Some people can get dizziness from a panic attack, right? If we're stressed, I don't know if I had one, but if you're stressed and you feel really or threatened, and people with anxiety know what it's like to feel lightheaded and dizzy. And that's just your body's normal fight or flight system kicking in, and you can get dizzy-like symptoms. People with motion sensitivity. So remember I gave you that example of the mismatch between the ears and the eyes.
Yeah, the stop car. Yeah.
So some of us are born with a sensory mismatch. So you will know there are friends of yours that will not get on a roller coaster, don't like being in an elevator, aren't real fussy in Walmart. Those people tend to have what we call a sensory mismatch or motion sensitivity.
Okay.
And you inherit that from your parents. Most people know they have it, will just avoid a roller coaster or they'll avoid Other people are speed demons, adrenaline junkies, or can tolerate faster speed, right? So they suffer from that sensory mismatch like other people. So we'll see people with motion sensitivity. And if you have a concussion, and you're one of these people who's sensitive to motion, you're very dizzy.
Yeah, well, I understand, yeah.
Because concussion kicks you where you hurt.
Yeah.
One of the things we ask people if we see them who have a concussion, do you have a history of motion sensitivity? Because they will typically need a lot more vestibular rehab because they'll feel a bit more dizzy. And then there's inner ear problems, which are true kind of vertigo type issues that you can have in crystals. People with Meniere's have increased fluid in their inner ear. They can have dizziness and balance issues. So dizziness is really, really important to get addressed. You should know what's causing it. If you have pain, you want to know what's causing it. And the same should be dizziness. And when people say, oh, I'm just dizzy, that's nothing, it's my age. That's not safe. It needs to be addressed. So here at the Newfoundland Balance and Dizziness Center, we see a lot of people with balance issues. So seniors will come in and they'll say, my balance is off. So when they come in, we'll assess their risk. So we'll check their vision, check their inner ear, make sure it's not a vertigo problem. Check their
how do you do that? How do you check their inner ear?
Well, that's a really good question, and I'd love to show you how we do that next time.
All right, next time in.
So in physiotherapy, Nick, you can specialize to be what we call a vestibular physiotherapist. And vestibular just means vestibule, which is the Latin word for the inner ear labyrinth, the vestibule in the inner ear. So it's become known as vestibular system, the inner ear in the brain. And people who treat it like me are known as vestibular physiotherapists. So you can get certified and go on courses. And I was lucky enough, the ENTs here sent me so many vestibular patients, I had to get certified. So I went to Emory University in Atlanta, Georgia, has Herdman. And Susan Herdman writes the book on vestibular therapy, and she does a 6-day intensive course, and you can become certified vestibular physiotherapist. So from that, you learn how to do what we call a vestibular assessment. And the vestibular assessment is what you would have done if you came here. A balance assessment includes a vestibular assessment because we want to check your ear. And basically what a vestibular assessment is to check the function of the ear. So we have technology called an infrared goggle system.
Okay.
Set over your eyes and check to see if you have what we call nystagmus. And nystagmus is you do, right.
Yeah.
So it's a symptom either of an inner ear
left eye.
Inner ear problem or a brain problem, right?
Yeah.
So that's part of the vestibular assessment. So we look at your eyes, because the eyes are a window to the ears and to the brain.
Yeah.
And with that infrared goggle, we can videotape and look for nystagmus or abnormal eye movement. So we'll do a series of head movements, eye movements, ear pressure tests just to check the ear. And then as part of the vestibular assessment, we'll check you from a neural point of view, so your reflexes, your ability to move your eyes, and your muscle strength, and your reflexes, and then we'll do a balance assessment. So that's when I put you in the harness, how you can put all those systems together and execute balance strategies, like an ankle strategy, a hip strategy, or a fall prevention stepping strategy. So that's the vestibular assessment. It's
there you go.
But it's a great assessment to help identify why you're dizzy or why your balance is off. Yeah,
definitely. I mean, that's in depth. That's impressive. So, I was going to ask you also about you're doing actually, I'll ask you more first of all about balance Dizziness Center. You said so you have the track, the goggles, and what other equipment or what equipment were you going to buy? Were you planning to buy before March 31st that would have made this even better?
Right. So there is vestibular diagnostic equipment, and in balance and dizziness centers in the States and other places in Canada, they have what they call a VNG, and a VNG is just diagnostic testing that's usually done by an audiologist that helps test the integrity of the ear, the 5 sensory organs, the nerve, and it's a bit more detailed assessment of the inner ear to help identify the cause of balance issues or dizziness. And in Newfoundland, we're lucky there are 2 VNG machines. One is at the Janeway, and they have three audiologists there who are trained in using it. And
that's the Janeway. Sorry, Janeway is a children's hospital, and also earlier the village is the mall in St. John's. So one of the malls in St. John's. Anyway, sorry, instead of for people not from Newfoundland.
Right.
So
the Janeway is where audiology is. An audiologist has the test there in their facility there, and in Western Newfoundland they have one. But there's none in private clinic, and there's a wait list, and the wait list varies, I'm sure, from province to province. But in Newfoundland, our wait list is quite long for that vestibular testing. So I've partnered with an audiology company, an audiologist here in town, and we have staff being trained to be able to offer that vestibular diagnostic testing here.
Nice. And so what kind of credentials do staff need to have before they can be a certified audiologist?
So the audiologist is similar to a physio and OT in that it's a master's degree that you would study. An audiologist,
like speech language pathology.
Yep, an audiologist. Okay. Yep, they're different, but the audiologists do a lot of hearing testing and treatment for hearing issues. And as the balance sensor in the ear is attached to the cochlea, hearing can be affected in people who have inner ear problems such as balance and dizziness. And here's the exciting thing. In Grand Falls, Windsor, there's the Genomic Research Center, and Newfoundland Balance and Dizziness Center has partnered with them to help identify people in Newfoundland who already have hearing issues that may also have a balance gene or
that's good. Wow.
Yeah, so we're really excited about that. We've partnered with Anne and her staff out there at and we've set up a clinic in the Excite building in Grand Falls, Windsor, because we're really looking forward to bringing our services to that part of Newfoundland, but also being involved with their research on hearing and balance issues, and we're really excited about that.
Oh, so that's so VNG is that's the main thing you wanted to looking to purchase, and how many physios do you have in and what other services do you provide that in a balance and dizziness?
So Nick is funny. When we opened, it was myself and the secretary. It was 2 of us.
Yeah, I remember that.
And we've grown. So from 2 of us now, there's 17 of us. So there's 7 physios. 3 of our physios are doing neurological rehab. 3 of our physios are doing vestibular rehab, and I'm hiring a 4th. And our other physio is Kevin Parfrey, who does mainly dry needling and orthopedics. So
he gave me dry needling in February or in February after the storm, this big huge snowstorm here. I was having my back he tried needling my back and fixed it right away. I was like I said, a knot in my back or some lower back or whatever. But yeah, after I saw Jan, she said good to him, try needling, so I went and did that, and it was great.
Yeah, we're very fortunate here, Nick. Yeah. We have a fabulous team. I'm so excited about our team. I could go on and on about our team, but we're very lucky here. So Kevin is kind of our sports therapist, backs, necks, and sports injuries, and he's fabulous. Kevin has a background in exercise physiology, plus he was an OHL hockey player, a Canada rugby player, and his family is very involved in sports. So Kevin's fabulous, so he brings that extra orthopedic piece to our services. And so if we have a concussion patient who might have sprained their ankle during the concussion, people can get all their services at one spot, right? And then, as you know, we have 3 neurotherapists here, Jen Shears being one. Jen has almost 3 years experience doing neuro rehab.
Great. I was happy with her work on me. It was great, I think.
Yeah, and she's like a ray of sunshine, and every patient will tell you that. She's very skilled. Her communication skills with the patients are fabulous. She's got a heart of gold. And people call us just to see Jen, right? So she's done a lot of work with our neurologist here, Dr. Squarey, in the Movement Disorders Clinic, and is a big part of the Parkinson's rehab program at the Miller Center and also here at our clinic.
Nice.
Then we have Hillary Cole, who is a physiotherapist who just moved back home. Hillary's got a lot of skills in spinal cord injury rehab and spent a lot of time out west on a spinal cord injury unit and in private practice doing neurology. She's on the side. She has her own sleep rehab program. She's a sleep specialist, and as you know, people with concussion, people with new babies, and sleep is becoming a very important, talked about thing nowadays. And Hillary's got a lot of skills in helping people with sleep rehab and sleep hygiene. So we're lucky to have her, and then we have Tamara Penny, also who's specialized in neuro rehab, and she's certified in the program called LSVT Big, and we offer here at our clinic LSVT Big and LSVT Loud. And basically,
what is that?
Yeah, they are 4-week programs, 1 hour a day, 4 days a week for 4 weeks, directed at people with neurological problems that cause movement impairment or speech impairment. So LSVT Loud is for people who have speech impairments, for example, from Parkinson's disease. So their voice volume deteriorates, their voice amplitude deteriorates. So our speech therapist, Nancy Shorn-Curris, she's certified in LSVT Loud, and Tamara, the physio, she's certified in LSVT Big. So they've been offering those programs, those 4-week programs, to people with Parkinson's or neurological conditions. And then Hillary Cole, also, she went away for us and got certified in Mind Move. So we offer Mind Move here now also. And Mind Move is a program that was developed in the University of Toronto. And physios and OTs can get certified in providing Mind Move. And basically, Mind Move is a program that U of T developed to help paralyzed arms and hands recover. Wow. It's a functional electric stimulation through electrodes to the skin, to muscles in the hand, the arm, and the shoulder, to help people who've had a stroke or a spinal cord injury regain movement in their limb. So wow. Hillary got certified in that for us last year and has been offering Mind Move to our clients.
That's very impressive.
Yeah, it's the technology now, Nick, for vertigo rehab and neuro rehab is really exciting.
It is.
Our clinic has that technology here and is offering that to people in Newfoundland and Labrador. To get Mind Move, you have to go to Ontario.
Yeah.
But we offer that here now, and we're really excited. We have a number of stroke patients that are availing of that program.
Nice.
I want to say, Nick, that physiotherapy in private is covered by most people's insurances.
That's good now for people.
Yeah, so people have Blue Cross, Great West Life, pretty well every insurance company. We bill, and we can direct bill insurance companies, so they don't have to pay up front.
Great.
Yeah,
that's good. So you guys are obviously not operating now, but I mean, if this was, say, a normal summer, which is not, but if, let's say last year or whatever, what kind of injuries would you or conditions would you expect to see in the summer or in the spring going into summer?
So summertime for us, wintertime there's icy conditions. So we see some falls and stuff, right? Summertime our concussion referrals ramp up because kids are playing outdoor sports.
Right.
So kids are on their skateboards, kids are playing soccer. So our concussion from outdoor sports ramps up in the summer. for outdoor sports. We still have concussion referrals all year long because there's indoor sports, cheerleading, water sports, water polo, cheerleading, hockey in the winter too, right?
Yeah.
So we see more of those sports-related concussions. But summertime we see more outdoor rugby, soccer, sports. Falls can happen any time of year.
Yeah, they can.
And the majority, a lot of falls happen in people's homes. I think almost 50% of falls happen in people's homes. So and a lot of concussions, 41% of concussions are from falls. Sports. And now people are home, so a lot more. So. Yeah. So on our website, Nick, we have a lot of information on fall prevention.
What is the website?
It's nlbalance.com.
Okay. nlbalance.com.
nlbalance.com. And under services, you can go under fall prevention. And we have a lot of resources there for our clients. Well, anybody across the world can look at the website. But there's a fall risk assessment tool there. There's handouts on how to fall-proof your home, how to prevent falls, such as reviewing medications, blood pressure checks, having your vision checked, and how to fall-proof your bathroom, kitchen, how to climb ladders. You name it, everything is on the website for fall prevention. We're a big advocate of fall prevention because the majority of falls are preventable. And so here's some messages I'd like to share. Falls are preventable. Falls are preventable. Dizziness is treatable. And concussion is treatable.
Exactly.
So those are really important, happy, good news messages to share with your audience because there's hope, there's rehab, there's treatment.
There is.
Through balance. And I'm a huge balance advocate. Since the 80s, participation has gained a lot of traction, right? In the 80s, everybody got out and did walking, aerobic work to get your lungs, your muscles stronger.
Yeah.
And then the last 10 years, yoga has really gained a lot of traction. For flexibility and for settling and mindfulness, which is really important. But balance never gets its due attention. And balance assessment and balance training and just balance and fall prevention should be a conversation in every household. And I work with it all day long, but I live it in evenings and weekends because I'm a mother and I'm also a daughter.
Yeah.
In my house, when my kids come home or when my kids are there, because my kids are 10, 11, and 20. And my mother in her 70s, and my mother's the youngest of 9, and she has brothers and sisters that are 87, 91. So every day, my thoughts are on where's the safety hazards in
your aunts and uncles and stuff.
Exactly. So our stairs are never cluttered. They're not wet. There's no throw rugs. Nothing is put up in a high shelf. Floors have to be dried. My kids anyway, are not allowed to wear Crocs if they're running or playing. They're only allowed to wear them for swimming. My mother, if she comes to my house with these lovely, pretty, fancy slippers that have no heel support, I don't let her wear them. She's not allowed to wear her Crocs because falls are preventable.
What are high heels? What in general, not just for your mother, but for people in general, for women in general, high heels? Your thoughts? I know, I get it, Joe. I don't want to give you, so don't answer that. That's my thing. High heels, I just don't understand that. But anyway, but I'm a guy, so who knows? But anyway.
Hey, you're not off the hook that easy. In the 70s, guys wore high heels too. So, hey, look, I get the high heel gene too. I like high heels just as much as anybody. But I've had 3 falls wearing heels. One was on Water Street going downstairs. One was in the health sciences, and one was coming out of my driveway. Huge fall risk. I don't wear them anymore because I preach this, I live it, and I don't want to fall again. I wrenched my shoulder. But you have to examine your footwear. And on my website, Nick, There's a handout on appropriate footwear to prevent falls.
Excellent. And so people can find your website is nlbalance.com.
Yeah, you're a little bit.
And I'm not fuzzy.
I'm getting a bit of static.
Okay, I'll try to fix that. Is that better? There's been a connection thing, but hopefully not. The odd things was being broken up. The odd bit of hands and wrists make that thing on the computer. But is that better?
No, you're still really. Now I hear it. I'm not sure if you hear it, but our website, just to give it to you again, is www.nlbalance.com. And on that website, along with fall prevention, there's a lot of information for people and families, mothers, parents, coaches, for people with concussion.
Great. Yeah, no, that's very important. And also, while everything is closed now, you are doing telehealth. And I know Natasha Wilch and Thrive Neurosport, Kay Mitchell at Thrive Neurosport in Kitchener-Waterloo. Natasha Wilch is in Nanaimo, BC, and Kay Mitchell is in Kitchener-Waterloo. But you're in St. John's, Newfoundland, and you're doing telehealth. And I just wanted to touch on what is telehealth physio, like what rehab or telehealth rehab. What is that? How is that different, and what do you do? Like, how can you do physio work via telephone?
Nick, you're such a great interviewer. Great question. Great question. And certainly a very timely question. They're going to want you on CBC next. So, yes, let me talk to telerehab. So we are delivering care now in the middle of a crisis. With this COVID pandemic, everybody's in the middle of a crisis. And it's kind of been a shock to the system, really, for many reasons for me. One, as a business owner, we're gone from 40 visits a week to 0 visits a week per therapist, right? So, but in crisis comes change, and we've had to make a lot of change in a very short period of time. Mm. And because we live in 2020, our access to technology is really helping the world with this pandemic for a number of reasons. One is because of the technology and we can communicate. The first thing happened to me is my colleague who owns the Atlantic Balance and Dizziness Center in Halifax reached out, and we also reached out to Bernard Tonks out in British Columbia, and we've had conversations, emails, and webinars on how to deliver our services to our dizzy patients through telerehab. So it's fabulous that we can network with these experts across the country, across the world. So that's very exciting for us. So I'm trying to find some silver linings in this pandemic, and one of them has been our ability to use the internet to provide services to our clients and also to support each other as a profession. So
you ever see patients in, say, like BC or Alberta, or not locally? Do you ever see?
Definitely. Well, now what it's like, with communications. You can speak to anybody in the world. And here's an example. When I first opened my clinic, I had a patient who was a golfer who had lost balance function in his ears from IVs, antibiotics. It's called ototoxicity. And he said to me, Kim, will I ever golf again? And I really didn't know the answer to that question. Yeah. So I put on the email Susan Herdman, and I said to Susan Herdman, who's at Emory, she's the what's the chances? But anyway, I emailed her, and a day later, she emailed me back. Nice. Right? Yeah. I went back to my golfer client, and I said, here's the research that's going on in rats now. It looks like the hair cells may be able to regenerate. Yeah. We haven't seen it in humans yet, but don't give up hope. Yeah. Right? So that's just one example. So yes, Bernard Tonks is a vestibular therapist in Canada, out in BC. He owns Rise Health. And he's offering virtual sessions to anybody, and you can go on his website, log in, and book an appointment. Nice. Right? So they're offering that to their clients out west. Sue Edler is in Nova Scotia. She's doing virtual rehab for our dizzy clients. And certainly we're here at Newfoundland Balance and Dizziness Center with our vestibular therapists online waiting for referrals and people to call us.
Well,
so
yes.
here's where we were out ahead of the game. Newfoundland Balance and Dizziness Center, because our patients are dizzy, for years I've been doing telehealth.
Okay, that makes sense, yeah, because they can come in.
Or through Skype, because patient in, Red Bay, Newfoundland, who has internet but can't afford the flight here, or there's no physio up in Red Bay. Yeah. So I've been doing tele-rehab with our clients across Newfoundland and Labrador for quite a while now. So we just had to ramp up our platforms and ramp up our services and technology. So we started offering tele-rehab right after we closed March 29th.
That's true.
Yep. So our dizzy patients, our concussion patients are doing tele-rehab sessions with our physios, our OTs, our psychologists and counselors. And basically, it's on our website. If you don't know how to do it, you go on our tele-rehab website and you can read all about how to book a tele-rehab appointment. All you need is a phone, an iPad, or computer. You can use Google, Safari, any of those browsers, and you just type in our address, and we're nlbalance.doxy.me, but that's on our website. And basically, we do it through them just like you and I are talking through Skype.
Okay.
The platform we use is compliant with security standards. I know there's a lot of controversy now about different platforms and review of platforms, but we one that's HIPAA certified. And basically, we can do our vestibular assessments, review our exercises, progress exercises, answer questions, review programs. Our concussion patients are kind of finding this a silver lining because they're finding right now that the world has slowed down to their pace.
Yeah.
You're a concussion client and you've had a concussion, busyness, loud, movement, noise, bright lights, interaction, all those things are very stressful.
Yeah.
So a bit of a silver lining, some of our concussion patients now are doing their return to work, starting remotely, which has been very, very helpful to make that adjustment.
Yeah.
So tele-rehab, we were doing probably one tele-rehab session a month since we opened to our clients who don't like to drive or who are dizzy or who are around outside of St. John's across Newfoundland and Labrador. And now we're doing it all day.
Oh.
Let's say when we come out of this, we'll probably be offering some of our clients, or our clients may request more tele-rehab services.
Yeah, because the way Newfoundland is, it's Newfoundland, the island is it's tough to get centres. So it's tough to get centres such as advanced as yours, but smaller places that are scattered, and it's a difficulty shaped province to really get places to get everything together in one center, because there's no center really. There's a center, but not as many people live there.
We don't realize, it's a $1,200 flight from Labrador, or it's a 12 drive from Labrador or Port aux Basques, right? So tele-rehab is really helpful for people who don't have access in their communities.
Yeah, no, I think that's a great thing. I think telehealth and like this sort of active physiotherapy, active health that you can do via video conference or video phone, even just phone online. So the video system they use is from Balance Business, the website. Should you provide that? So
the platform we use, we email you a web address that you can put in your browser. You and I could run this call through it.
Okay.
And then open the email and just click on that, put that browser in here and just hit enter. And it'll come right to what we call a meeting room.
Great.
So you'll see welcome to Newfoundland.
Like Zoom kind of?
Yeah, you'll see welcome to Newfoundland Balance and Dizziness Center. Your appointment will start in 2 or 3 minutes. Your appointment with Kim. And basically, I'll just hit start, and we'll see each other and start our conversation.
And do you as a physio, do you find that difficult to analyze someone's? Well, I guess you're not really analyzing movement because you're looking at the more vestibular system. But Do you find the online system is I mean, it's obviously good. It's really good, but as opposed to being in person, or do you have preference for being in person?
So, Nick, I've been doing it for quite a while.
That's true.
So
Yeah.
I'm very comfortable with doing the therapy.
Yeah.
Up my competencies by doing, webinars on virtual care. I've had lots of experience, so I'm very comfortable doing it.
Yeah.
I have resources like Bernard Toggs, Sue Eatler. If we have a complicated patient, we can network and how the best way to do this. We have all kinds of safety things we put in place. The person has to have an emergency contact if they faint while they're on virtual care. We have their emergency contact so we can get somebody to them.
That's excellent. Yeah.
A lot of safety things, safety measures that are put out by the Canadian Physiotherapy Association, Newfoundland and Labrador, your provincial registering body, and then us as professionals ourselves have guidelines on how we do safe assessments and how we perform safe treatment in people's homes. To get back to my team, our speech-language pathologist, Nancy, she worked in the United States doing speech-language therapy for years, all through telemedicine. So we're, because Nancy's been a real leader for us.
Yeah, I bet.
She can tell us how to check our speed, what platforms, how to share documents. Like Nancy's been a real leader for us.
Yeah.
And Hillary Cole, our other physiotherapist, she's been doing her sleep rehab through virtual care for quite a while, so she's very comfortable. Nice. Yeah, so we were kind of out of the gate a little early with our confidence in our skills. We had our system, our technology already in place, and we also do electronic medical records, so our therapists can all work from home because they have access to electronic medical records through our platform.
Perfect. That's great. So, yeah. Sorry?
Well, let me finish. You asked me about my team. I wanted to...
Oh, yes, please do. Please.
Just a few accolades. Our massage therapist, Kathy Cole.
Okay.
She is here, and she's adapted her treatment for our dizzy patients. So she does chair massage. She modifies her therapy for our neck patients and our patients who are dizzy. So we've really been lucky to have a massage therapist who's invested her time and learned extra skills. Jake Warren is one of the best soccer players in Newfoundland, I'd like to say, and Jake brings a lot of sports experience with his vestibular rehab and our concussion rehab for our athletes. And we just had another therapist join us last year, Rebecca Long, fabulous therapist. She moved back to Newfoundland, thank God. A lot of skills in vestibular rehab and concussion rehab, so we're very fortunate. And we have our OTs, our Adrian Toms, who also moved back to the Rock a few years ago with a lot of experience in neuro rehab and veterans rehab. And we have a counselor, Sabrina Butt, and our psychologist, Renee Fairhealy. And I hope I haven't forgotten anybody. And then we're very lucky because we partnered with Memorial, and anybody who has a university in their city, Memorial has a fabulous kinesiology program. So we have kinesiology students all year long, and we also get physiotherapy and OT students from overseas in Glasgow, Caledonia, from McGill, from Dalhousie. So we're very fortunate in being able to have a lot of people who are passionate about their work to help us with those services.
No, definitely. I highly recommend Bounce just because I've been there a few times. It's great, and and I think everyone should, anyone in St. John's, of course, or Newfoundland, that can make the effort to visit if they need any way to visit it. But anywhere in the world now, online, where can they find you online or on social media?
Well, it's funny you asked me that question. About a year ago, we had an email and a phone call from this 86-year-old man in Minnesota.
Yeah.
And he was looking up Dizziness, and he found our website.
Yeah.
So he phoned.
Yeah.
And I spoke to him, and he was dizzy. So I just Googled vestibular physiotherapist in Minnesota, and I found him a provider in his town. I still gave him some education on what was going on with him because he was quite stressed and lived alone.
Yeah.
But Yeah, the world is a small place now. So our website is just nlbalance.com. We're on Facebook. And what else can I tell you? We're here to help.
You're on Twitter too. Do you use that much? Or?
Yeah. I have a lot of young staff.
Ah.
So helping me get up onto Instagram.
All those kids, huh?
But Nick, look, another shout out to you. You know, you walk the talk, and Concussion Talk that you started provides people with a lot of resources and well-needed education. And just a big thank you and applause to you for all the work you've done and efforts you've done with your podcast, because it's really important, because living with dizziness or concussion or brain injury is a challenge, and but there's supports there, and there's a lot of good services like you provide. So hats off to you and to Concussion Talk.
Well, thank you so much, and you provide amazing services as well. And hopefully, like I said earlier, hopefully this summer be able to get outside and experience the recumbent bicycle that you have ready for a triathlon or whatever. Hopefully, I don't know if any sports will go ahead this summer, but or even any in the next few months, but sometime eventually. Let's just say sometime.
Well, I really look forward to biking with you, Nick. I really do. We'll get out on those beautiful Newfoundland East Coast trails and burn up the dust.
That sounds good. And actually, before that, you go, just a quick question: how is your running going now? I know because your psychiatrist loves to run, so. Yeah.
So running is kind of a passion. That's my mental health. And my best friend, who happens to be an OT, Margie Collingwood, is a lifelong runner. And when I moved back here, I moved half a mile from her. And for the last 10 years, she gets me out running twice a week. And we just do it for leisure, for health, and for mental health.
Do you do far? Do you run long distance? Or I know when I met you the first time, we were about to go to London or Berlin do the marathon.
Yeah, it was the London Tri. If anyone ever wants to do it, it's the best triathlon in the world.
Okay.
Yeah, but no, I'm not competing except for the Telly 10. Most Newfoundlanders want to do the Telly 10. Yeah. So Margie trains me enough so that I can get that 10-mile race done once a year. But other than that, it's just a 40-minute run. And that triathlon in London, that was a 50th birthday challenge.
Oh, was it? Okay. Was it successful?
I got it. I did it. Yeah.
Nice. Well, there you go.
The swim was the biggest thing for me, but it was fabulous. Thanks.
Was it full distance triathlon?
Yeah. Once in a lifetime on the bucket list.
Nice. Well, thank you so much for being on this podcast, and hopefully, I know people will learn a lot from it, but hopefully they will, and they'll contact you at nlbalance.com for telehealth, or for just looking up information about dizziness and concussion and physiotherapy. And if they're in St. John's, Newfoundland, they can visit you where again?
I tell everybody the old Canadian Tire building, 6 Elizabeth Avenue, right next to Piatta's.
I was going to say we're behind Piatta Pizza, yeah. That's people, yeah. But thank you so much, Kim, and it's great talking to you.
Thank you, Nick.
I encourage everyone to visit the website nlbalance.com. And if you're in Newfoundland and Labrador or St. John's in particular, visit their clinic on Elizabeth Avenue beyond Piatta Pizzeria. In the meantime, please visit my website at concussiontalk.com. You can find me on Twitter, Facebook, Instagram at concussiontalk. And I hope you listen again soon. Thank you. As always, music at the beginning of this podcast is by Ben Sound. www.bensound.com.